Many children are extremely picky eaters, especially toddlers. There's a stage of development between that age of 2 and 3 where it's almost the norm to be a little bit picky. However, your child may have a feeding disorder or may have or need some extra help with their feeding skills if that pickiness hinders any kind of typical development. So if it hinders the development of going through what textures and transitioning from the bottle to solid foods, from pureed foods to table foods, then that may be a time where you need to get some intervention or at least some guidance. Also, if it interferes with normal health, so if your weight or nutrition energy levels are affected, that can be a diagnosable feeding disorder. And then last but not least is if it affects your daily functioning. So if your child is not eating at preschool, is not eating at school and having energy levels and not able to participate in the feeding times at school or in different social situations, or if mealtime itself is just a struggle every night and they're not improving as they get older, that may be a reason to contact Speech Matters and see what we can do to help your child with their feeding. There's a wide range of characteristics in feeding that can be atypical. One of them is if the children excessively gag. So it's not typical for children to gag excessively on foods. Also, if they vomit their food without being sick or without choking, that's cause for concern with feeding. Children who are consistently upset at mealtime, that's not typical. When children have a very limited menu of foods that they'll eat, so sometimes there'll be a 4-year-old who only eats Tyson chicken nuggets and McDonald's French fries and will not eat anything else. That can be atypical. When your child refuses to eat food based on how it looks or how it feels, it's typically texture-based versus taste-based when there's an actual feeding issue there. Poor chewing skills, so if your child just looks like they're struggling to chew up different textures of food, they pocket food in their mouth, those can be signs that you may need some help. Also, too, if there's low energy levels for your child. So if your child is very limited in what they eat and they're playing soccer and different things and it's starting to affect their energy that they need for that, that can be helped by a speech therapist who specializes in feeding, like we have here at Speech Matters, who can really help set up a plan to get these kids back on track with their feeding. So if you're concerned with any of these signs, or if you're just frustrated with the overall feeding of your child at home, please contact, you can always call us and see if your child would qualify for an evaluation, and we can answer any of your concerns that you may have with your child and their feeding.